The powerful pineapple secret that stops joint pain after 60. But there's something you must know first. I bet you didn't know. This sweet tropical fruit contains a secret enzyme that doctors are calling nature's anti-inflammatory miracle. We're talking about pineapple. And what I'm about to share with you could revolutionize how you deal with joint pain after 60. But here's the thing nobody tells you. There's a right way and a potentially dangerous way to use this powerful fruit for healing. Recent research published in the Alternative Therapies in Health and Medicine journal shows that people taking bromelain, the active enzyme in pineapple, experienced up to 60% reduction in acute joint pain and over 50% improvement in chronic pain conditions. That's not just pain relief. That's life-changing improvement. But here's what shocked researchers the most. This natural enzyme worked just as effectively as prescription anti-inflammatory drugs, without the dangerous side effects. If you're tired of waking up stiff, struggling to open jars, or feeling like your knees are grinding with every step, this could be your answer. But before we dive into the incredible healing power of pineapple, there's something critical you need to know about safely using this fruit. Because while pineapple can be incredibly healing, eating it wrong could actually make some conditions worse. Before we get started, tell me in the comments, what's your biggest joint challenge right now? And have you ever noticed how your body reacts to acidic foods? I read every single comment because your experiences help shape these videos. Now, let me tell you why pineapple isn't just another fruit, but potentially the most powerful natural anti-inflammatory you can eat after 60. The secret lies in an enzyme called bromelain, and understanding how it works could change everything about how you approach joint health. Here's what happens inside your body when chronic inflammation takes hold of your joints every time you move. Microscopic damage occurs in your cartilage and surrounding tissues. In a healthy body, this damage triggers a repair response that quickly resolves the inflammation and rebuilds stronger tissue. But after trends, two problems create a perfect storm for chronic joint pain. First, your body's natural anti-inflammatory systems become less efficient. The enzymes that normally break down inflammatory proteins and clear cellular debris start working slower and less effectively. Second, your body begins producing more inflammatory compounds called cytokines, which can create a state of chronic, low-grade inflammation throughout your joints. This is where bromelain becomes absolutely revolutionary. Research from the University of Connecticut shows that bromelain doesn't just reduce inflammation, it specifically targets the inflammatory pathways that cause joint pain and stiffness in older adults. Unlike NSAIDs that simply block pain signals, bromelain actually addresses the root cause of joint inflammation. Here's how bromelain works. It's magic in your body. This powerful enzyme acts like a molecular cleanup crew, breaking down fibrin deposits and inflammatory proteins that accumulate in your joints. A groundbreaking study published in Clinical Rheumatology found that people with knee osteoarthritis who took bromelain daily experienced a 41% reduction in joint pain and swelling. Even more impressive, the enzyme continued working for weeks after people stopped taking it. But bromelain does something even more remarkable for aging joints. Research from the International Journal of Molecular Sciences demonstrates that this enzyme actually helps rebuild damaged cartilage by stimulating your body's natural collagen production. Remember, collagen is the protein that keeps your joints cushioned and flexible. After 60, you're losing about 1% of your collagen each year. But bromelain can help reverse this process. The bioavailability of bromelain from fresh pineapple is extraordinary. Studies show that when you eat fresh pineapple, about 40% of the bromelain survives stomach acid and makes it into your bloodstream intact. This is significantly higher than most other plant enzymes, making pineapple one of the most effective ways to deliver natural anti-inflammatory compounds directly to your joints. A clinical trial published in Phytomedicine followed 73 adults with chronic joint stiffness who added fresh pineapple to their daily routine. Within 2 weeks, participants reported significantly improved morning flexibility and reduced pain during daily activities. By the end of 1 month, 68% of participants said their quality of life had markedly improved. Now, let me share the optimal way to use pineapple for maximum joint benefits. The key is timing and preparation. Research shows that consuming pineapple 30 to 60 minutes before meals maximizes bromelain absorption, while minimizing potential digestive irritation. You want to eat about 1 cup of fresh pineapple, which provides approximately 1,200 milligrams of bromelain. But here's something crucial. Not all pineapple is created equal for joint health. The bromelain concentration is highest in the core and stem of fresh pineapple. Many people throw away the core, but that's actually where you'll find the most therapeutic compounds. The core might be tougher to chew, but you can blend it into smoothies or juice it for maximum benefit. Canned pineapple, unfortunately, contains virtually no bromelain because the heat processing destroys the enzyme. If you're serious about using pineapple for joint health, fresh is absolutely essential. Look for pineapples that are golden yellow and give slightly when pressed. The skin should have a sweet, fruity aroma at the base. Here's a game-changing tip from naturopathic physicians who specialize in arthritis treatment. They recommend eating pineapple with a small amount of black pepper. The compound piperine in black pepper can increase bromelain absorption by up to 2,000%. Just a tiny pinch is all you need to dramatically boost the anti-inflammatory effect. Let me share a real-world example that perfectly illustrates pineapple's power. Robert, a 65-year-old retired teacher from Arizona, had been dealing with severe hip and knee pain for over 2 years. He tried glucosamine, prescription, anti-inflammatories, and even considered joint replacement surgery. After learning about bromelain's benefits, he started eating 1 cup of fresh pineapple with black pepper every morning. Within 10 days, Robert noticed he could walk upstairs without holding the railing. By week 3, his morning stiffness had virtually disappeared. After 2 months, his doctor was amazed at the improvement in his range of motion and reduction in joint swelling. Robert's story isn't unique. It's exactly what we'd expect based on the scientific research. The anti-inflammatory mechanisms of bromelain are incredibly sophisticated. Research published in the Journal of Inflammation shows that this enzyme specifically inhibits nuclear factor kappa B, a key inflammatory pathway that becomes overactive in arthritis. It also reduces the production of inflammatory cytokines like TNF-alpha and interleukin-1 beta, which are primary drivers of joint pain and stiffness. What makes bromelain even more remarkable is its selectivity. Unlike pharmaceutical anti-inflammatories that suppress your entire immune system, bromelain specifically targets pathological inflammation while leaving beneficial immune responses intact. This means you get powerful pain relief without compromising your body's ability to fight infections or heal injuries. A comprehensive review published in the European Journal of Pharmacology analyzed data from 12 clinical trials involving over 800 participants with various forms of arthritis. The researchers concluded that bromelain supplementation consistently reduced pain, improved joint function, and decreased inflammatory markers, with effects comparable to prescription NSAIDs, but without the cardiovascular and gastrointestinal risks. Now, let's talk about bromelain's remarkable effects on the cellular level. This enzyme doesn't just treat symptoms, it actually helps repair damaged joint tissue. Studies show that bromelain stimulates the production of new cartilage cells, called chondrocytes, while simultaneously breaking down damaged proteins that can interfere with joint function. Research from the archives of physical medicine and rehabilitation found that people with sports-related joint injuries who consumed bromelain recovered 50% faster than those who didn't. The enzyme appears to accelerate the natural healing process by improving circulation to injured tissues and reducing the buildup of inflammatory debris. For people dealing with rheumatoid arthritis, bromelain offre unique bénéfice. A study published in Autoimmunity Reviews showed that this enzyme can help modulate the autoimmune response that drives RA, potentially reducing the frequency and severity of flare-ups. While more research is needed, early results suggest bromelain could be a valuable addition to conventional RA treatment. The versatility of pineapple for joint health extends beyond just eating the fresh fruit. Some people find that applying fresh pineapple juice topically to swollen joints provides additional relief. The enzymes can penetrate the skin and help reduce localized inflammation. However, always test a small area first to ensure you don't have skin sensitivity. Here's an important consideration for timing your pineapple consumption. Research suggests that eating pineapple in the evening might provide enhanced benefits for people who experience morning stiffness. The anti-inflammatory compounds work throughout the night to reduce inflammation while you sleep, potentially leading to more flexible, comfortable mornings. A fascinating study from the University of Hawaii followed adults over 60 who incorporated pineapple into their daily routine for 6 months. Not only did participants experience significant improvements in joint comfort, but they also reported better sleep quality, improved digestion, and enhanced overall energy levels. This suggests that bromelain's benefits extend far beyond just joint health. Now I need to address something absolutely critical: the potential risks of using pineapple for joint health. While this fruit can be incredibly beneficial, it's not appropriate for everyone, and there are some important safety considerations you must understand. Important safety warning: when pineapple can be dangerous. Here's what most health articles won't tell you. Pineapple's high acidity can be problematic for certain people, and eating too much can actually cause harm. Pineapple has a pH between 3 and 5 R, making it one of the more acidic fruit. For some people, this acidity can trigger or worsen several health conditions. If you have acid reflux, GERD, or peptic ulcers, pineapple could make your symptoms significantly worse. The combination of natural fruit acids and bromelain can irritate an already inflamed digestive tract, leading to increased heartburn, stomach pain, and potential damage to your esophageal lining. Research published in the American Journal of Gastroenterology shows that acidic fruits like pineapple can trigger acid reflux episodes in up to 73% of people with existing GERD. The bromelain enzyme, while beneficial for joints, can also cause digestive upset in sensitive individuals. Common side effects of consuming too much bromelain include nausea, diarrhea, stomach cramping, and excessive menstrual bleeding in women. A study in the Journal of Ethnopharmacology found that doses above 1,500 milligrams daily, roughly 1 5 cups of fresh pineapple significantly increase the risk of gastrointestinal side effects. Here's something particularly important for people taking medications. Bromelain can increase the absorption of certain drugs, potentially leading to dangerous interactions. If you're taking blood thinners like warfarin, antibiotics like amoxicillin, or sedatives, pineapple consumption could amplify these medications' effects. Always consult your healthcare provider before adding therapeutic amounts of pineapple to your routine if you're on any medications. People with certain allergies need to be especially careful. Pineapple allergies can cause reactions ranging from mild mouth irritation to severe anaphylaxis. If you're allergic to latex, you're at higher risk for pineapple allergy due to cross-reactivity. Symptoms can include hives, swelling, difficulty breathing, and digestive distress. A 1,993 study found that 20 out of 32 people with confirmed pineapple allergies experienced anaphylactic shock after eating the fruit. The acidity in pineapple can also be problematic for your teeth. Regular consumption of acidic fruits can erode tooth enamel, leading to increased cavity risk and tooth sensitivity. If you're using pineapple therapeutically, consider drinking it through a straw and rinsing your mouth with water afterward to minimize dental damage. For people with kidney stones, pineapple's oxalate content could be concerning. While pineapple isn't extremely high in oxalates compared to some foods, people with a history of calcium oxalate kidney stones should consume it in moderation and increase their water intake when eating pineapple regularly. Here's the safe approach to using pineapple for joint health. Start with small amounts, about half a cup of fresh pineapple every other day, and gradually increase if you tolerate it well. Pay attention to how your body responds, particularly your digestive system. If you experience any stomach discomfort, heartburn, or other concerning symptoms, reduce the amount or discontinue use. Never eat unripe pineapple, as it contains higher levels of acids and compounds that can cause severe mouth and throat irritation. The flesh should be golden yellow and give slightly when pressed. If you have any chronic health conditions or take prescription medications, consult your healthcare provider before using pineapple therapeutically. For people who can't tolerate fresh pineapple due to acidity, bromelain supplements might be an alternative, but these should only be used under medical supervision. The concentrated enzyme in supplement form can be more likely to cause side effects and drug interactions than the natural enzyme in fresh fruit. Despite these important warnings, for most healthy adults, moderate consumption of fresh, ripe pineapple is safe and potentially very beneficial for joint health. The key is finding the right amount for your individual tolerance and health status. Remember, while pineapple can be a powerful tool for managing joint pain and inflammation, it's not a replacement for proper medical care. If you have severe joint problems, chronic pain, or any concerning symptoms, work with a healthcare provider to develop a comprehensive treatment plan. So there you have it, the complete picture of how pineapple can help rebuild your joints after 60, along with the crucial safety information you need to use it effectively and safely. This isn't just about adding a tasty fruit to your diet. It's about understanding how to harness nature's anti-inflammatory power while respecting your body's individual needs and limitations. If you're ready to try the pineapple approach to joint health, start small. Listen to your body and be consistent. Many people begin noticing improvements within the first week, with more significant benefits developing over the first month. Just remember to be patient with the process and prioritize safety over speed. What questions do you have about using pineapple for joint health? Have you noticed any connection between acidic foods and your symptoms? Drop your thoughts in the comments below. I read every single one and use your feedback to create better content for this community. Always consult your doctor before making any dietary or lifestyle changes, especially if you are managing a medical condition. If this information helped you understand more about natural approaches to joint health, please hit that like button and subscribe for more evidence-based health strategies. Until next time, stay healthy, stay informed, and remember that the right natural approaches can make a real difference in how you feel every day.